Hello, I'm Ian Davis. I'm Chair of ANZUP, and I'm here at the ANZUP Annual Scientific Meeting in July 2025. And it's an absolute joy to welcome Dr. Marniza Saad. Marniza is a clinical oncologist from the University of Malaya Medical Centre. Marniza, thanks so much for coming to our Annual Scientific Meeting.
It's my pleasure, Ian. I'm really glad I'm here. This is my very first time in ANZUP, in Sydney also. And I'm just so happy to be here. I've been enjoying the meeting so far, and it is fantastic meeting. And I wonder how come I've not been to ANZUP before.
Yeah, it was an oversight on our part. We had to get you here much sooner. You and I worked on a few different projects over the years, and one of the reasons that we really wanted you to get here is that you are well known as someone who mentors and fosters the development of your junior team, the people who are going to follow you. Can you tell us, how do you incorporate that into your everyday life? You must be very busy clinically. How do you incorporate mentorship into your everyday activities?
Yeah. So, of course, you and I, many of us wear multiple hats all the time. And because I do clinical work and education all at the same time, so I suppose mentorship doesn't really meaning that you have to take away like a slot. Okay, I'll do mentorship now. It's about doing it every day. So, for example, in the clinics, I'm mentoring them, right? And it's about showing them what to do, how to be a good clinician, how to perhaps deal with patients, talking to patients, and discussing all the treatment options that we have. I think that's all happen on a day-to-day basis. Of course, there are some times that we might have to take away, to provide some time away from the clinic where we might need to do that discussion. So I think it's about making time. Certainly, it's not going to be easy, but I think if we try to make time and think about the impact that it may have on the trainees, their journey, and what's going to happen, in their career in the future. So I've been able to make that time so far.
That's great. Well, you and I are doctors, and a lot of people watching this are going to be healthcare professionals of different types. We're kind of hardwired. When people come to us and they want a solution, our natural inclination is to say, oh, here's what I would do. Here's what I would recommend for you. Where does that fit into the mentorship conversation?
Yeah, exactly. You know what, Ian? I think most of us gets into like mentorship, not formally. So most of us have not been trained to be a mentor, and I feel actually maybe that's where the unmet need is also. Meaning, perhaps, we should do some training to become a mentor. But of course, back to your question. To me, most of the time, it's not about me giving them the solution. It's about allowing them to share what the issues are, what they actually want to do, and perhaps more about guiding them on which options are feasible and how they move forward, rather than telling them this is what you should be doing. Of course, sometimes it may help them if I share perhaps my own experience when maybe similar things have happened and how I had approached it. That might help. But I try not to then tell them this is what you should do. I think it's best to try to get them to find the way themselves.
And so much of it is about generating your own personal experience,
Yeah.
isn't it? Because their experience is not going to be what we experienced or
course.
in our time.
Of course, of course. But many of them told me that they find it useful when I share my experience, maybe something quite similar, and then they will see how that can be put in their situation and how they can resolve the issues that they are facing.
Another challenge in day-to-day work is, I personally find challenging, is I need to consciously step back and allow my trainees and junior staff to lead the ward round, lead the consultation, talk to the patients. Do you find that that's a challenge for you as well?
Sometimes, but I feel, we need to give them that opportunity. And that's how they learn. I believe that they learn by doing. They make mistakes, of course. And we have incorporated in our training what we call workplace-based assessment, because it's competency-based, right? And I think it's a great opportunity for them to improve their competency, but at the same time to go through all these interactions that they would have had with patients. And by doing that, not only we assess their competency, clinical competency, but we are also giving them opportunity to share with us how they approach certain things. And I think by doing that, we can identify perhaps a room where they've done very well and room to improve. So I think learning from their own experience is really, really important. And the other thing is, what I find useful also is learning from observation. Unfortunately, we run a very busy clinical service. This is where I think it's very hard for them to be able to observe us in clinic, because we'll be sitting in our own clinic rooms and running the clinics. But it's so powerful, and I'm trying to remind myself on the way that I learn from my own mentors in the past. And I learn a lot by observing them when they interact with patients. So I believe, that's a powerful way of training or mentorship also, but unfortunately not easy to do it in a busy clinical setting.
A beautiful part of this sort of interaction is how much you yourself benefit out of taking part in it. I learn so much from watching the team I work with doing things in a slightly different way, seeing things in a different direction, and they're constantly teaching me information.
Definitely. I agree. And I grow. I believe I grow as I mentor the young generation, the future oncologists. Actually, I learn so much from them myself. And I've changed sometimes. I've adapted, certain things on the way that I interact with them or I teach them based on what I observe. Um, so we need to communicate at their levels. And I believe I have changed a lot compared to when I started 20 years ago.
So if you had just one or two tips for someone who is interested in becoming a mentor, or for someone who is looking for a mentor, what advice would you get back?
Yeah, that's quite a tricky question. Okay. Um, Perhaps for those who are becoming a mentor, right? To me, maybe, we have to realize that it's not an easy task. Um, but I think bear in mind that it's going to be a very rich journey where we're not only helping someone, uh, but we're also helping ourselves. I think because we grow together. So I think to me, it's a very worthwhile experience, very enriching, and I've really enjoyed it. So I think it's about, enjoying every time, every moment that you spend with the mentees. And for those who are trying to find a mentor, the mentee, again, we talked about this earlier, the mentorship program, how do we match? Should people be matched by the system, or should we allow some flexibility? It's a tough one. I believe it's actually a relationship, because most of the time, of course, we would have to match people together. And I think it's allowing the mentee should get to know the mentor, and to find ways to where, the relationship can grow. But of course, at the same time, not limiting it to just the mentors that has been assigned. And we heard just now about chemistry. So I think sometimes you cannot really choose your mentors. I think you meet people and you just find, something that you like,
Yes.
that you feel that will help you grow. So I think keep it open, uh, and allow that connection and that chemistry to grow.
We heard a great quote yesterday in the meeting. We're in the people business,
Yeah,
and
that's right.
we're people too. And I
Yeah,
think
we're people
we
too.
get
That's
just as
right.
much out of these relationships
That's right. That's right.
as the people on the other
That's right.
side.
I've had situations where I had challenges with the mentee because we just couldn't, the chemistry wasn't there. But I think sometimes we can work on it, right? We get to know that person and allowing that person to get to know us. And then we might find something similar that we can work on together.
Well, that's a great point to close on. Ma, you're a fantastic role model. Thank you for all that you do. Thanks for your fantastic contributions to our annual scientific meeting. Safe trip home when you get there. We're really looking forward to being able to work with you again.
And thank you very much, Ian, for giving me this opportunity to come here, learn. I like the team very much. Listen, reflect, and connect. And I'm so inspired by ANZUP. Thank you so much.
Thank you.